Hey there, Dr. Jeremy here. Have you ever wondered if you can use electricity to regenerate your patient's cells? If so, you'll absolutely love this short video class that I've taken from one of my recent live training events. Here, I go into detail about the EAM medical paradigm so you can gain a clear understanding of our medicine, which will drastically improve your patient and clinical results. Now, if after watching this video it resonates with you, I'll show you a way that you can dive deeper with me to attend my upcoming live event. Enjoy. This is our medical paradigm. The medical paradigm says that we are constantly regenerating new cells. I'm sure you all have heard that in biology class. And cells are always wearing out and need to be replaced. So disease, especially chronic disease, occurs when we lose the ability to make new cells that work, or when these cells cannot function properly. So your entire body rebuilds itself in less than 2 years. Approximately 98% of it rebuilds in less than 365 days. Now, every cell in your body eventually dies and is replaced by new cells. So every day is a new opportunity to build a new body. So here are some cellular regeneration times. Blood regenerates every 4 months. That means 4 months from now, those same blood cells that we have today have died off and new cells have taken their place. If you look at the stomach, it's one of the faster tissues to regenerate. It takes approximately 5 days, and there are some cells, such as the parietal cells, the ones that produce the acid, the stomach yin, that regenerate possibly within minutes. So every few minutes we get new parietal cells. Pretty cool stuff. So knowing the cellular regeneration times aids in predicting realistic disease reversal times. Means understanding this paradigm will help your thought process in your clinic and will help your patients when your patient asks you, well, how long will it take for my broken bone to regenerate? Well, if you know that it takes a certain amount of time for bones to grow and regenerate, and you know that you've solved their problem and that bone should be regenerating properly, then you can give that patient a reasonable time frame for when that issue will heal. If somebody has heartburn or a stomach ulcer, well, you know that once you correct the patient's disease, that those cells will start to regenerate, and you know that it's only 5 days for the inner lining of the stomach to regenerate. So that stomach issues, once you fix all the problems, are one of the faster things to help our patients with. This is just a slide of more cellular regeneration times. I've taken it from a standardized biology book, which I also referenced in the back. Mostly everything I teach this weekend, I've referenced in the back. So then we can ask the question, well, what is needed for cells to regenerate and function properly? Number one is electrons. And in your head, anytime I say electrons, I want you to think chi. And anytime I say chi, I want you to think free electrons. Now, I know we all studied extensively, thousands of hours, Chinese medicine, and we know that there's many different types of chi. This chi, number one on this list here that I'm specifically referring to, is the chi that flows in the acupuncture channels. Number two is the gu chi. This is the raw nutrients, the building blocks of cells. Because how can you build a house without bricks? How can you build cells without amino acids? How can you build neurotransmitters without amino acids? How can you do anything without the raw building blocks? And it's under our scope of practice as acupuncturists to help the patient with their diet, with supplements, with nutrition, And we need to take care of these two things listed here on the slide. Number one, we have to make sure that we restore the channel charge or restore the flow of qi to the organ or tissue so that it can function properly or so that it can regenerate. And two, we have to make sure that the patient has enough guqi or raw nutrients so that these cells have the materials they need to function properly. Roughly, we can measure these things, and roughly, we found -20. Why do I put negative there? It's because electrons have a negative charge. Voltage is a measurement of pressure, electrical pressure. And if you noticed in batteries, they're rated with voltage. And when batteries drain, let's say a 9-volt battery comes to you brand new around 9 volts, when it drains and becomes dead, that voltage will drop lower, below 6, below 5, below 4. In our body, as you're going to see in a few slides, our bodies have individual batteries which store this benevolent qi in the channels and are fed to cells for cellular regeneration and functioning. And it's measurable through machines and formulas. And healthy acupuncture channels in tissues should measure around -20 to -25 millivolts. And when that's for normal cellular functioning, let's say I smash my thumb and it needs to regenerate. In order to regenerate, the voltage, the qi flow needs to go higher than -50 millivolts. If there's a problem in an acupuncture channel and it cannot reach above -50 millivolts, maybe it's going to not regenerate properly. It's not going to heal properly, or it's going to heal much too slow, or it's never going to heal, depending upon what kind of problem my channel is. Is my channel able to reach -50? Is it able to reach -25? Or maybe it can't even get above -5, in which case I'm not going to heal very well. So what are our electrons? I told you they are negatively charged particle. There's no S on the end of that, and that's because there's a theory that says there's only one electron in the universe, and it's everywhere at once. It's readily available in the earth and in batteries. Now, this is pretty cool. They function as antioxidants and as a power source. And it is the single most powerful healing force available to acupuncturists, especially electro acupuncturists, because inside a battery is a massive, dense amount of this benevolent qi. So how much medicine is contained in something that costs $1 or $2? A ton. As you're going to see, I prefer, if you're using an Ito machine, I prefer a half-dead battery. So I have a battery that in one of my Itos that I was using to teach a class 3 years ago. I don't want to give it up. The more dead it gets, the better the treatment gets. You'll see what I mean coming up this weekend. So then we ask the question, what supplies electrons to cells, organs, and tissues? Well, that's the acupuncture channels and the conductive outer covering of nerves, which is actually the epineural covering. For some reason, multiple classes, multiple years, I still have not changed this word to epineural. So cross this perineural out, I intended to be epineural. So then we say, what are the acupuncture channels? Well, the acupuncture channels are made up of several different tissues. One of them is the muscles. One of them is the fascia. One is the epineural covering of nerves and cells, such as cell membranes, which have tiny capacitors. And a capacitor functions, in this case, like a small battery. So then we can say, what is muscle tissue? Well, if you studied physics, they have an atom smashing experiment where they take one atom and they smash it, and out from that atom comes an infinite amount of particles. They can isolate one of these particles and smash it again, and an infinite number of particles come out from that one particle. So it's something that is coming from nothing. Well, muscle tissue functions a little bit like that. It's piezoelectric. And so we have electrical devices in acupuncture. They're little clickers. And when you click it, a little spark comes out and stimulates an acupoint or a muscle. And that's called a piezoelectrical acupuncture device. Well, piezo, they are referring to every time you put pressure on a crystal or a crystalline structure, it emits chi. It emits electricity, negatively charged benevolent energy. Well, the muscles in our body also function in a piezoelectric manner, meaning when you put pressure on them, when you stress them, when you stretch them, when you move them, they start emitting chi from nothingness, similar to the atom smashing experiment. They can generate chi from nothing. If you took a crystal and set it here on the podium and did nothing, nothing would happen. No chi would be emitted. It's only when you put pressure on it that it starts emitting chi. If you do nothing with the muscles, if you don't move them, if you don't stress them, if you don't stretch them, don't expect them to emit chi. Another cool quality of muscle tissue is that they can function as a rechargeable battery, storing this negative electric charge for use on demand by the tissues and organs that are fed by the acupuncture channels. So what is fascia? Fascia is considered a superconductor. It allows electrons to flow in one direction only, similar to a DC circuit. And fascia covers every single muscle, every single skeletal muscle in your body, and it is the most electrically conductive tissue in your entire body. Not the nervous system. It's actually the fascia. So we can see that, like I said, the fascia surrounds all skeletal muscle, and it links more than one muscle together in a circuit, and it provides a wiring system. This is important as part of the paradigm to think about that groups of muscles, stacks of muscles that are all on the same fascial wiring circuit are on the same acupuncture channel. For example, all the muscles along the stomach channel are wired together in a circuit and separated in a discrete circuit from the channels that are next to it, which is really cool. This is what allows us to measure them. This is why I can measure voltage on the stomach channel, say stomach 41, for example, and move just one sun medial and measure the liver channel at liver 4. I'm only one sun difference, but it's a complete different circuit, and that has to do with stacks of different muscles being wired together in the same fascial plane. So then we need to ask the question, well, what are nerves in relationship to the acupuncture channels? Well, the acupuncture channels, as much as we'd like them to, don't go everywhere. They don't feed every single tissue. They feed all the major organs. They feed all the major lobes of the brain, but they don't feed every single tissue. We need this chi to be able to go where it needs to go, and one of the pathways is the epineural covering, which is very highly conductive, on the outer surface of the nerves, which is way more electrically conductive than the portion of the nerves that actually stimulates motor or muscle function. This is just intended to show you different parts of nerves, but today we're focusing for our paradigm on the epineural layer, which is the most electrically conductive tissue of the nerve. So then we can ask, what are the most electrically conductive tissues of the body? And this will help you when you're talking to other acupuncturists or other practitioners who have the current belief or paradigm that the acupuncture channel system is the same exact thing as the nervous system. We need to be very clear, and just by being clear that an acupuncture channel system exists outside of the nervous system, this gives us a tremendous benefit and power in our understanding of what we're doing and how we can actually help patients. And I have another slide coming up on this, but I want to make sure everybody's absolutely clear before we leave the paradigm section that there is a nervous system, there is an acupuncture channel system, and they're two completely separate things. We can have beneficial influence on both as long as we keep in mind what we're doing and that the two exist separately. Mainly, understanding that the acupuncture channel system is its own complete thing outside of the nervous system. If somebody has a root canal in the earth teeth, you will 100% of the time find that the voltage is decreased in the earth channel. 100% of the time, not 70% of the time. So what are the most electrically conductive tissues of the body? One is the fascia, which you already know. And qi flows unidirectionally, not backwards. Two is the epineural covering of nerves. There should be a 2.5 in here, which is the fibrous covering of arteries and veins. So 3 main pathways to get qi out to the body. One, the fascia, from the muscles into the fascia, into the organs and tissues. 2, the epineural covering of nerves. Picture the Renin-Nadu channel and how the spinal nerves come out of the spine, the sympathetic nerves, and feed every single organ. Qi from the Renin-Nadu, which goes in a circle, as you know, will exit on the outer epineural covering of these spinal nerves and feed the organs. And qi also flows on the highly conductive surface of blood vessels, such as arteries and veins, because it's highly conductive. Number 3, blood and fluids are highly conductive, and we have a bunch of protocols. We can use this to our advantage, and we're going to be going over this in the protocols section, how we can insert qi directly into the blood, because blood goes a lot of different places. And where blood doesn't go, lymph goes, and we can use the lymph system also to put this benevolent qi in there, and I'm going to show you how to do that to help your patients. Number 4, which is low on this list, is nerve fibers. This is the using electricity to stimulate the contraction or relaxation of muscles. And make the distinction in your head that we have the outer covering of these nerves, which sends qi to the organs, cells, and tissues for cellular regeneration. And if you keep cranking up the power, you'll be able to get a muscle to contract. And when you get that muscle to contract, it can be benevolent and beneficial for the patient in that you're putting stress on this muscle and getting this muscle to now release qi, which is going to be amping up the voltage and the charge in the channel. It's also going to be pumping fluids around, such as lymph and venous flow. So it can be a benevolent thing. It's also going to reconnect the brain with that muscle, because we tend to get neuroinhibitions. Maybe playing football age 10 and you get slammed in the side, that your body has a protection mechanism. It'll deactivate a certain set of muscles, meaning those muscles won't fire as well as before, and we can help the patient by disinhibiting those muscles. So then we can ask, what is the least electrically conductive tissue of the body? And thank goodness it's the skin. Imagine if we didn't have skin, these lights in the studio would be zapping me. The cell phones, the computers, they'd be able to just travel as they want right through the skin and affect me in a negative way. So we can see the skin as one part of Wei Qi, the defensive Qi. Now, this is pretty cool. It's a way of thinking about human physiology and anatomy. It's just a picture which pulled apart these stacks of muscles so that you can see the Qi flow from a different point of view. And here's another view which I thought was cool. Here's the stomach channel. So this muscle here is sending Qi down, because that's the other great thing that the ancient Chinese came up with. They knew about the acupuncture channel system. That's where we're getting it from. They were pretty brilliant. And they labeled, for the most part, 90% of the channels flow in the direction of the number system that we're currently using. Now, somewhere along the way, the number system changed a little bit, and that's why I'm saying 90% of the channels flow in the direction of the channel system. What do I mean by that? I mean, stomach 1 is on my eye, and stomach 36 is on my leg. And because of that numbering system, I know that on the stomach channel, the Qi is flowing from my eye down the stomach channel to the leg. So that if I have a Qi deficiency in my eyeball on the stomach channel, inserting Qi into stomach 36 is probably not going to reach the eyeball, because the Qi on the acupuncture channel is going to flow down. Stomach 36 to stomach 40 to stomach 45, wrap around, come into the next channel, and flow up the body. So if I need Qi at stomach 1, I need to get my needle either before stomach 1 on the previous channel or at stomach 1, if I'm attempting to use the acupuncture channel system to feed the tissue, or I'm working on a channel problem. This will be more clear when we go into further slides. This is basic channel flow. So from the acupuncture channels, the Qi flows from the muscles into the fascia, into the central circuit, into the epineural covering of nerves, and out into the organs. In this slide, which probably, I hope, appears again at a different time, is very important, because this is how we can create the optimal treatment protocol simply from understanding Qi flow principles. Keep in mind that atom smashing experiment where they smashed an atom, a single atom, and an infinite number of particles came out. You can smash each one of these particles an infinite amount of times, and an infinite number of particles will come out of it each time, because of the current universe we're living in. At least my universe. The heart is a muscle, as you all know. If I remove the heart from the body, it'll beat without any input from the nervous system. Every time the heart beats, Qi is released from nothingness. From the muscle tissue of the heart, Qi is released. And what surrounds the heart is a massive conductive fascia called the pericardium. So out of nothingness, the heart beats. When the muscle tissue, the heart beats, it's emitting this benevolent chi. When this benevolent chi goes into this highly conductive sac called the pericardium, then from there enters the pericardium channel and starts cycling around through this pathway. So down the pericardium channel, wrapping around into the triple energizer channel, up the triple energizer channel, into the gallbladder channel, down the gallbladder channel, wrapping around into the liver channel, so on and so forth, until it makes its way into the kidney channel. Kidney channel dumps chi into the Renin-Du. It circles around the Renin-Du and is able to enter the epineural covering of the spinal nerves and enter the organs. Our brain needs chi flow, so it can enter from the Renin-Du. It can enter from different channels. Frontal lobe is stomach channel, for example. Fire channels feed parietal lobe. These things are all figured out using electrical measurements. And this chart is really showing three different pathways, the three different major pathways, because we said that the acupuncture channels don't exactly reach every single tissue and cell that we want it to. So the first pathway from the heart, emitting chi into the pericardium channel and into the acupuncture channels, into the pericardial sac, into the acupuncture channels. Pathway number two, from the heart into the pericardial sac and on the fibrous covering, which I labeled on these yellow arrows here, to where these blood vessels go. So the chi flows from the heart into the pericardial sac, and then on the fibrous covering into the arteries and veins, into every tissue, or into the tissue that is near these arteries and veins. And the third pathway pictured on this chart are these nerves, the epineural covering of the nerves coming off the heart. So, in summary for this slide, chi flows out of nothingness from beating heart tissue, heart muscle tissue, into a highly conductive sac called the pericardium, and then from there into the pericardium channel, entering all the acupuncture channels, wrapping around, ending up at the Renin-Du, and then ending up where it needs to go. That's pathway one. Pathway two, from the heart into the pericardium, onto the fibrous covering of these arteries and veins. And pathway number three, from the heart into the pericardial sac, onto the epineural covering of nerves, and to everywhere that nerves go. So then you may say, well, how does the chi know where to go? Well, that's because chi flows where the least electrical resistance is. Another way of saying the same thing, where the most electrical conductiveness is. And I said chi flow, but I can say electricity flows to areas of least resistance or areas of most conductance. Well, areas of most conductance or least resistance are the diseased tissues that need the chi. If my stomach organ does not have enough chi, it's starving for chi, its resistance drops, it's willing to accept more chi, more so than all the other organs on the stomach channel. Here's another way of seeing the same energy flow pathway that we just saw. Now here's proof of concept. I don't know why anyone would use a X-ray machine and radiation to prove a concept. However, somebody did it, and because they did it, we might as well use it. This is before and after. It's a little bit hard to see, but I'm highlighting it here with my red pointer. This is soft tissue edema. It's not supposed to be there. Simply by adding this benevolent chi the soft tissue edema goes away. Here is osteoarthritis. On the left here is before adding qi, and on the right here is after adding this benevolent qi. And this slide can be important because many of you have heard, and I've heard it before, that there's nothing acupuncture can do for something like osteoarthritis, right? Well, here is X-ray proof of electricity making changes in osteoarthritis. So I no longer believe what I hear, that acupuncture cannot help something hard and physical like osteoarthritis. Just print this and shove it in that person's face and say, here's X-ray proof. And by the way, if you guys have questions, I'm going to do a Q&A session after every session of teaching. I'm going to do a Q&A. We'll spend 10, 15 minutes on each Q&A. So if you have a question, save it, and then I will ask you, what's your question? And we can, at that time, we can go back to a slide if you want. Here's a side view, before and after, simply by adding qi to the proper place. Now, this slide is to emphasize the difference between the neurological system and the channel-based acupuncture system. Keep in mind, we can influence both. There's nothing preventing you from influencing both, but the power comes in being very clear on this. We live in an ambiguous world, muddled with toxins, mental toxins, physical toxins. The clearer we are about this paradigm, the better our understanding of our medicine becomes, the more we can help our patients, the more we can help the world. So just keep in mind, the acupuncture channel system is separate. It exists on its own. The nervous system is separate from the acupuncture channel system. It exists on its own. But we do have the power to influence both. As you know from some of my other classes, we can influence the autonomic nervous system. We can regulate things. And we can also improve acupuncture channel flow to fix internal medical conditions. Are you guys excited yet? So let's talk about, that's the paradigm. And many of you have already mastered the paradigm. If not, please master it by the end of this weekend. It's not hard. Ask your questions if you have questions about paradigm. Paradigm is very important to understand about this. It's a way of understanding our medicine in an optimal way to maximize the way we communicate with other healthcare practitioners and our patients. It's also a way to maximize how we think about our patients when we're trying to formulate different diagnoses and protocols. Look for a link below this video and click on it to get all the details.